a senior director of Rehab 2. I'm a doctor of physical therapy. I oversee Malala, Chehalem, and McMinnville, and I'm the direct DOR of Malala and Chehalem. I have been with the company just over 20 years. So on March 29th of this year, I woke up in uncontrollable pain, and I realized that I couldn't move very well, and specifically, I couldn't move my left leg at all. I went to the hospital, over 10 days in the hospital with many tests performed. I was diagnosed with a complex hemiplegic migraine. As a therapist that has been doing this for a long time, I had never heard of that. It basically looks like you've had a stroke. Yeah, I received physical therapy and occupational therapy in the acute setting, the hospital. Then I also received physical therapy and occupational therapy at home via home health, and I am now currently getting outpatient physical therapy. All three therapy settings were very different, and they really gave me a renewed appreciation of skilled nursing. I realized that all settings are experiencing staffing shortages right now. Therapy in the hospital seemed really brief, and it was really spaced out. Home health was definitely more personalized, but it was only 3 times a week, so I was really scared to practice harder things on my own. I was using a walker and had a really high fall risk, so I didn't want to practice it the days they weren't there. They were also seeing up to 10 patients a day, which seemed crazy since I knew they had to drive to each location. Outpatient is currently 2 times a week. They're very busy and are usually juggling about 2 to 4 patients at the same time. So usually I'm doing my workouts with therapy aides, which is kind of funny because they keep asking me questions about what I do in skilled nursing. I have always loved working in the skilled nursing environment, but I definitely appreciate being able to collaborate with other disciplines in skilled nursing, being able to get to know our patients more because we usually see them 5 times a week. I appreciate that the therapists are usually able to speak to a person's family, especially since visitors are still not allowed in most hospitals, but they're open in the skilled nursing facilities. I enjoy group therapy with my patients because they get to see how their peers are doing, and I've seen that really motivate patients, and I didn't get to do that in any of the settings I've been in. My mother had to go to one of my skilled nursing facilities right before the pandemic hit, and she still knows all of the nurses and all of the therapists' names because they were able to get to know her, and she told me she felt like she knew them. And I always felt like that was the true definition of culture of caring. The connection that we get with our patients, I do feel is different than the other settings. We know them longer. We get to work with them typically longer than any of the other settings. And it becomes more personalized therapy. You know what their goals are, and you're able to really work on those goals. And it, especially because skilled nursing also, most all of them have a long-term care component where patients actually live there for the rest of their lives. So you may know them for years. Skilled nursing has changed so much over the years. But one constant for me is the variety of patients that we get to see. One day I may be treating a younger person in their 20s with an MVA and multiple fractures. Then another day I'm in the memory care unit with a Parkinson's patient, or working with a new amputee, showing them a new leg, and working on building relationships with a patient that has dementia, and then they finally trust you enough to let them walk with you is really special. And I actually get asked a lot, why do I do skilled nursing? And I got asked in all 3 of the settings I've been in, why do I do skilled nursing and what makes it special? And I love that I really get to know my patients, and especially the long-term care patients. They're so special to me. There's one that lives at my facility now in the memory care unit. And I've known her for years now, and I know that she's religious and she likes to sing. Before her memory got worse, she would sing all the time, and now she can barely talk. And when I used to work with her, she'd get really confused, but I would go up to her and I would start singing. I would sing either You Are My Sunshine or Amazing Grace. And Amazing Grace was always her favorite. And when I was gone for these 3 months, I was sick, and I worried about my patients. I really wanted to see them again. And I heard that this patient went on hospice. And so I was really worried I wasn't going to get to see her again. And last week I was able to go into her room, and she wasn't really acknowledging anyone anymore. And I sat on her bed and I started singing Amazing Grace. And she lit up, she opened her eyes, and she smiled. And even though she can barely speak, she started singing back. And she's amazing at harmonizing. So she was literally harmonizing with me to Amazing Grace and interacting, and it's just amazing. It's amazing to have that connection with patients and know that they remember what we do for them.